Imagine this. You've got pain and it's shooting down your leg, maybe even numbness or tingling into your foot or into your hand. And you've tried so many different things: heat, stretching, pain meds or muscle relaxers. But the problem is the pain or the numbness, the tingling, it just keeps coming back. Now, I want to share with you why that is. Now, most of the time, it's coming from a bulging or a herniated disc. And those types of issues, they're not about pain in your back. It's actually about the pressure on the nerve that's connecting your brain to the rest of your body. Now, my name is Dr. Al Simeone. I'm from the Disc Chiropractic located in Wheat Ridge, Colorado. And today I want to help you understand what's really happening if you're experiencing any symptoms like the ones I just mentioned. And I want to give you some information about how you can fix these symptoms without the need for surgery. Think about the disc kind of like a spacer between a bone, right? This disc right here, it creates the room for the nerve to exit. And this disc, it's kind of like a sponge. Um, it can actually dehydrate. And when it does, it thins and it narrows the pressure or narrows the hole where the nerve exits, and that could lead to pressure on the nerve. Now, at the same time, this disc can also bulge or herniate. When that happens, it looks something like this. Now, whenever that nerve gets irritated, it will lead to a variety of different symptoms. Based on where that nerve travels to in the body, that will result in a different symptom. So the nerves at the top part of the spine can cause pain, numbness, tingling, even muscle weakness into the arm and into the hand. Whereas, the nerves into the lower back, when those get irritated, can cause pain, numbness, tingling, or even muscle weakness into the legs and into the feet, or what would be classically be called sciatica. Now, when that nerve is getting irritated, that's when you start to experience these symptoms. Um, Sharp pain, burning, numbness, tingling, weakness. It's not a back problem. It's actually a nerve communication problem. And your nerve system, it's like the operating system of your phone or of your computer. And if the connection is bad, then nothing will run smoothly. And that's kind of similar to the symptoms that you experience if you have a bulging or a herniated disc. Now, most people, they end up trying a variety of different things. They'll rest, they'll use pain meds or muscle relaxers. They might try physical therapy, massage, acupuncture, or they might have even gotten to the point where they're looking for injections. Now, the problem with most of those therapies is that they're focused on the symptom instead of being focused on the structure that's actually causing the symptom, which is again, that's the disc and the nerve. And it's not that these treatments have failed, um, or that you have failed the treatment. It's just that these treatments aren't targeted for directly treating the cause of the injury. And one of the most common mistakes that I see people make is when they're using heat directly on the spine, when inflammation is present around the joint right here. Because the heat will actually increase more blood flow, increase the swelling, putting more pressure onto that nerve. The other major thing that I see people do is that they're putting ice on the location of the symptom, meaning into their glute or their leg or their foot. If it's radiating pain down to the leg, we're putting ice onto the shoulder, elbow, arm, or hand if they're seeing those symptoms into the upper extremity. The idea is that we should be treating the actual source of the problem. And that's exactly what we do here at the Disc Chiropractic. We start with clarity. First, we take digital motion x-rays. If it's for the top part of the spine, we want to see what's moving when you move by taking a flexion x-ray and an extension x-ray. Basically having you go chin to chest and taking a picture, looking backwards or up towards the ceiling and taking a picture, and comparing that with your neutral x-ray to see exactly what is moving and what is stuck. And that process is called, well, with that information, we do an analysis called a Penning's analysis to actually measure the injury. That way, we're not guessing, we're actually measuring. The same concept is applied to the lower back. We actually have patients take an x ray with them standing straight up. We'll have them lean to the left, lean to the right, and again, compare to see what is working, what is moving when they move, and what is stuck. Because what is stuck is a great indication of where the injury is. And our care really integrates three proven therapies. When it comes to spinal disc injury, one of the gold standards for treatment is spinal decompression therapy. And you can think of this therapy as a deep, deep stretch for the joint. And as the joint is being stretched, it's pulling healthy fluid back into the disc. It's basically helping this to turn into this, pulling the fluid back into the disc, which actually rehydrates the disc and creates more space, opening up the space right here where the nerve exits. Another therapy that we use are precise chiropractic adjustments. We restore the alignment and the motion of the spine so that it's able to function the way that it was designed to, and it's able to adapt to the day-to-day stresses of life, allowing you to enjoy what's most important to you, whether that's hiking, skiing, or snowboarding, picking up a child or grandchild, and just being able to be active. And then the third core pillar of our treatment is therapeutic exercises. And that's usually done in a couple of different phases. In the beginning, we want to first stretch to create space, relieve the pressure off the nerve, and get the joints moving properly, especially between each and every visit. But after you've seen results, after you're getting more mobility and your symptoms are decreased, that's a great time to start stabilizing. Whether it be upper posture strengthening exercises or core stabilizing exercises. We teach you how to stabilize and strengthen once that pain has calmed down. And when it's appropriate, we also use other therapies like shockwave therapy, which is an excellent therapy to help accelerate the healing process for the soft tissues that are supporting the structures that we're talking about, the spine and the discs. Shockwave therapy actually melts away the scar tissue, muscle spasms, trigger points, calcified tissue, stimulates more blood flow to those tissues for faster tissue regeneration. And it's a great therapy that can be used with zero downtime. So our goal is to evaluate the issue, correct the alignment of the spine, restore function, and then strengthen and stabilize so that you don't have to have this repeat on you over and over and over again. Now, I do want to share a story about a patient. So he's a 43-year-old electrician, came into our office. He had searing lower back pain, sciatica running down his left leg all the way to his ankle. He had tried everything. Strong pain meds like oxycodone, massage therapy, physical therapy, and ice. But his pain was just getting worse and worse, and he came into us stating that his pain was a 10 out of 10. Now, he started treatment, and after a few weeks of decompression, adjustments, and therapeutic exercises, his pain was starting to ease. And by the end of the care, that we recommended, he reported that he was 100% improved in his symptoms. So no more burning pain, no more daily pain. Now, today, when he goes to work, he only feels mild tightness when he's climbing a ladder, especially when he's looking up. And of course, as an electrician, they're oftentimes wearing some of their equipment on a belt. Um, and so his improvement is incredible considering where he started. And you can even read a little bit more about his case in our case studies on our website. But when you see someone go from basically being hopeless to being able to get back up on their feet and do what it is that they love or what's most important to them, it reminds you how resilient the body can be when you give it what it needs and you allow it to have the right conditions, the right environment to actually heal. Now, if you've been told that, you just have to live with this, I want to make sure that you're aware that that is not true anymore. Bulging discs, herniated discs, they are progressive. Right? They can dehydrate, they can degenerate if they're left, you know, untreated. Now, the longer that the nerve stays irritated, yes, the harder that it does become to reverse that and to heal. But the good news is that with the right care, most people can start improving their symptoms within 2 months, and some more severe cases, maybe 3 months. So the question isn't whether you can heal, it's whether you'll take the first steps before it worsens and potentially becomes a permanent issue. So if you're ready to find the real cause of your pain and to truly start healing, we're offering a new patient consultation, examination, including any necessary x-rays, along with your personal health findings for only $47 in our office. Again, that includes that motion x-ray with that pending analysis, any orthopedic tests. That way you can understand exactly what's going on in your body. Because I believe that if you have quality information about your health, you will be able to make a quality decision about it going forward. And the reason why we're offering this is because the longer that a disc injury, like a disc bulge or disc herniation, goes untreated, the more that it dehydrates, the more that it compresses, and that makes recovery slower and takes longer. And so I want to make sure that you have an opportunity to get ahead of that. So all they have to do is click the link on the screen or just give us a phone call at 720-573-4910. So whether you come into our office or not, I hope that this information gives you some clarity about what is happening within your spine, as well as the confidence to realize that recovery is possible. These discs are living tissue, right? They can heal when we reduce pressure, restore motion, and re-educate the body. So I just want to thank you for watching. Again, I'm Dr. Al Simeone with the Disc Chiropractic, and I hope to see you at the next perfect time.